My name, as it shows on the screen, is Larry McLean. I volunteer with AgeSmart and currently serve as the chairman of the advisory council. I welcome your participation. If you're interested, my real job is the executive director of the St. Clair County Housing Authority. So I do have quite a bit of contact and insights to the needs and issues facing older adults, particularly as they relate to housing and staying in their housing until they have to make a move. We welcome you to the AgeSmart Community Resources Annual Plan public hearing. As members of the Advisory Council, it is our role to assure that the region has a comprehensive array of services. The public hearing is held to provide you, the public, with an opportunity to share information regarding the needs in your community and to comment on our plan for serving older adults throughout our jurisdiction. The advisory board, the advisory council, includes representatives from each of the 7 counties that comprise in the jurisdiction, and those include Bond, Clinton, Madison, Monroe, St. Clair, Randolph, and Washington. With funding under the Older Americans Act, the state of Illinois, and private resources, AgeSmart supports other organizations that serve older adults. Services funded under the Act are available to persons age 60 and above at the request of a voluntary contribution. Currently, AgeSmart funds 24 different service organizations throughout the jurisdiction. A summary of AgeSmart's annual area plan on aging is available on the website, which is agesmart.org. And we encourage older adults, their families, and caregivers, and the public in general to review the plan. It's now my pleasure to turn the presentation over to Joy Paith, AgeSmart's Chief Executive Officer.
Great, thank you, Larry. It appears that no matter what I do today, my advancing the screen doesn't seem to always work so well. So it's just moving slower than I wanted. But anyway, thanks for coming, and thanks, Larry, and thanks to the other advisory council members for joining us today. And we also have Phyllis Road from the Illinois Department on Aging, who's joining us this morning. We are AgeSmart Community Resources, your area agency on aging. And I'm Joy Paith, the Chief Executive Officer. And today we're going to share our area plan on aging. So let me give you a bit of background about AgeSmart and area agencies on aging. We exist to enhance the lives of older adults, persons with disabilities, and veterans. And we do this through advocacy, action, and answers on aging. AgeSmart's one of 13 area agencies in Illinois, and in 1973, the Older Americans Act was created area agencies to plan services for older adults to help them remain independent and support them in their communities. So as Larry mentioned, AgeSmart receives funding from the Federal Older Americans Act through the Administration for Community Living. And we have some additional funds from the state of Illinois, other grants, some private dollars, and through the Veterans Administration to support our robust veterans program. AgeSmart is a nonprofit organization governed by a volunteer board of directors who represent the region, and our advisory council helps to determine the services, the grants, and recommends the development of new programs. And you can see a list of those volunteers in our public information document. So I want to share a little bit about what we did in this past year and give you a little background of our aging network. So last year, the organizations funded by AgeSmart provided 42,000 older adults and caregivers services. The organizations funded are also listed in the public information document. Last year, over 500,000 home delivered meals were provided, and that was 30% more than in 2019. 70% of those people receiving those meals actually live alone, so they were very critical. 36,917 callers received answers on aging from our robust Information and Assistance Network, and 3,000 Medicare calls were answered during open enrollment. Over 3,000 caregivers were assisted with information, respite, and legal services. 120 veterans were assisted through our Veteran-Directed Services Program. And what you might not know is we provided services to grandparents who are raising grandchildren and giving them resources to help them with their new role as a full-time parent. But of course, we must address the challenges in the last year. And as we all had challenges, our staff has been working from home since March 16th, 2020, and our office has been closed to the public. But we did not miss a beat. AgeSmart, with the help of our incredible network and partners, continued to serve older adults. We provided more meals, delivered virtual programming, which we had never done before, and added additional 40,000 FEMA meals, and shout out to SSP who helped to get those out to the network. And we performed well beyond our yearly goals. So I want to share a little bit about our projected revenue. It's very interesting. The service is funded by the Older Americans Act. There's no means testing for them. The funding, so everyone over 60 is eligible for those services. The funding comes from the Act, from the consumers, and from community contributions. So I'm going to put a shameless shout out because those community contributions come from all of our fundraising efforts through the year and our grantees fundraising efforts. And this Thursday is Give STL Day, and that's always been a successful fund development activity for us. So watch out for our social media posts about that. But it's very critical that these community contributions are maintained, because that's what helps us provide services to those people who cannot make that contribution. And as you can see, our largest source of revenue fall into home delivered meals, access services, for which the region is comprised of transportation, assisted transportation, information assistance, options, counseling, legal services, and residential renovation and repair. Other sources of revenue for AgeSmart come from private contributions, a variety of grants, earned revenue from programs such as the Veterans Directed Home and Community-Based Service Program. Our expenses for AgeSmart fall into service categories: community services, the Nursing Home Ombudsman Program, congregate meals, health promotion, home delivered meals, adult protective services, and those access services I had talked about just previously. And of course, our Area Agency on Aging budget it's derived from administrative activities that include that advocacy efforts, coordination of services, and program development. So at this point, I'm going to hand it over to Kian, and she's going to share a little bit about the Area Plan on Aging and more details.
Great. Thank you, Joy. Good morning. I'm Kian Yak, the Grant Planning Manager at AgeSmart. Thank you for joining us this morning. This public hearing is a really great opportunity for you to learn about our services and share your ideas to help improve the senior services in your community. So I'm going to talk about some highlights of our area plan for the next fiscal year. So what is an area plan? Area Plan on Aging is our planning document. It's like a roadmap that guides us through the process of identifying the needs of the communities and coordinating and developing the services to meet those needs. It also serves as our grant application for the Older Americans Act services. We provide a summary of the area plan for the public, which is the public information document, and it is available on our website. All the information we discussed today and more can be found in this document. We follow a 3-year planning cycle. The upcoming cycle begins in October for the fiscal year 2022. Next slide. So the planning process begins with a needs assessment. We evaluate the current service system and identify any gaps in services. For this planning cycle, we distributed 3 different surveys. We did both paper survey and online survey. It was from November through January. First, we distributed a needs survey to older adults 230 older adults participated in the survey. We also invited local professionals to hear what they have to say about senior services in their community. And we surveyed caregivers to learn about the unique needs of the family caregivers we serve. We also reviewed the information and assistance consumer surveys that we had collected throughout last year. Almost 900 older adults participated in the survey. So what did we learn from our surveys? So we have gathered some great feedback from the surveys. And what really stood out was a need for chore service and handyman. Many older adults told us that they would need help with routine housework like cleaning and doing laundry and preparing meals. And there are, of course, in-home services out there, but the services can be expensive, not affordable for a lot of seniors. There is a homemaker service through a state-funded community care program, but it's only available for low-income individuals, which is an issue because there are a lot of older adults who do not qualify for the program, but can't afford the private pay service, and they are left with no options. And similar to the chore service, older adults who don't have a support system like friends and family or neighbor, they need help with simple tasks like changing light bulbs and replacing batteries in a smoke detector. And a lot of seniors also struggle with yard maintenance, like grass cutting, cleaning gutters, and snow removal. And this was a common theme highlighted in both older adults and local professional surveys. So the chart on the left is from the older adult survey. The question was, do you need assistance in any of the following? And as you can see, handyman, meal preparation, and routine housework were highly rated. The one on the right is one of the questions we ask professionals. What are the top 3 needs of older adults in your community? Nutrition and transportation are at the top, which confirms the importance of these funded services through Older Americans Act. Outside of that, homemaker and handyman were rated as the most needed services. Handyman was also at the top of the list of the new senior services they would like to see in their community. So we have more information about the needs assessment and the findings in the public information document. So we have identified the gaps. What do we do to address these unmet needs? So we recognize helping seniors with this, small tasks and chores will allow them to live independently in their own home as long as possible, which is our mission. So we'll address the need for chore service and handyman as our local initiatives for the next 3 years. For chore service, we're investigating some options, including a consumer-directed model, which allows a consumer to hire a person of their choice, and we reimburse the cost up to a certain amount. It is the same model that we've been using for our caregiver respite program, which has been very successful. For handyman, we know there are some great local resources already out there. So rather than reinventing a wheel, we'll collaborate with our community partners to maximize the resources. So more to come on that. At the state level, social isolation will continue to be our focus. Addressing social isolation has been one of the Aging Network's priorities for the past 3 years. And of course, with the COVID, we're avoiding social contacts and practicing social distancing. Older adults have become more isolated and lonely. It's like the very solution to keep our older adults safe has made them even more isolated. So 13 area agencies on aging in the state of Illinois, along with Illinois Department on Aging, will continue to work to address social isolation. We're educating our communities about social isolation and how to prevent it, and offer services reaching out to the older adults who are socially isolated. For example, last year we have expanded our telephone reassurance program. Our network provided over 10,000 reassurance calls to almost 3,000 homebound seniors. And our partnership with the Greenville University students created an intergenerational pen pal project. Students are paired with the older adults and they write letters to each other and they develop a really special friendship. So if you're interested or know someone who may be interested in having a pen pal, please contact AgeSmart. We're also offering virtual classes to help older adults stay connected. You can find a learning channel on our website, so please check it out. We also provide Memory Cafe. It is a social gathering for family caregivers and their loved ones living with dementia. Full-time family caregivers taking care of someone with severe long-term illnesses. They have a higher level of stress and higher risk of isolation. The Memory Cafe provides a very supportive and relaxed environment where they can connect with others and share information. So these are some of the programs we provide to address social isolation in our region. We'll continue to provide them through next year. But I also want to add that all of the Older Americans Act services that we fund are designed to connect people to the communities. So from nutrition services to transportation to caregiver support programs, the community-based services, they help older adults maintain their social networks, and we'll continue to fund those services. So next year, our service priorities, our goal is to maintain the current services, hopefully at the same level. All the services that we propose to fund next year are listed in detail in our public information document. The funding level is based on the governor's proposed budget, which could change. So if the actual amount of federal or state funding changes, then we will revise the service priorities. So most of our services will remain the same, but we have made some important enhancement to our caregiver programs based on what we learned from the caregiver survey. So Chris Fulton, our community-based service manager, will share with you the findings of the survey and the proposed changes and what this means to the family caregivers that we serve. So now I'll hand it over to Chris.
There. Sorry, I got my AgeSmart on. Oh, take it. My Surface blew up. I had to run into Joy's office. The Caregiver Support Services Program, as Keon stated, we sent out surveys to participants, professionals, and also to caregivers within the area. What we learned from the caregiver survey was that a majority of our caregivers are female, live with the person they care for, and what they need the most is a specific point of contact to talk with. We also ask what prohibits them from accessing services, and the biggest answer there was family dynamics and not knowing what services and supports were available in the area. We also ask how they prefer to receive their information, and that answer was they prefer a one-on-one contact rather than recordings, webinars, newsletters, and social media for that. The results of the survey made us reevaluate our respite program, how it was conducted. What we will start doing in October of this year is we will bring all of the assessments in-house, which means staff from AgeSmart will be the ones conducting the assessments, excuse me. At this time, Southwestern Illinois Visiting Nurses, our case coordination unit, is the one that's doing the assessments, but we found that we lack communication and information about our caregivers. So for 2022, we are going to start doing those ourselves. I'm trying to advance my own slides here. There we go. So how we're going to do that, improve our communication with our caregivers, is we've implemented a program called Tailored Care, T-Care for short. It's an evidence-based program that acknowledges the caregiver first. Family caregivers spend most time caring for their loved ones, yet are the least supported member of the care team. T-Care allows the caregivers and the caregiver specialists to identify strategies and services to assist the caregiver in their caregiving duties. It also involves follow-up at 3-month intervals to make sure that any of the strategies are still appropriate. Referrals may need to be updated or changed on this because all referrals are tailored to the caregiver's needs, preferences, and availability on that. Caregivers are also able to start this assessment process on their own by going to AgeSmart.org and taking the short version of the caregiver assessment. So with that, I'm going to turn it back over to Larry. Where is Larry? Yes.
Larry, your mic is off.
There we go. So I always mute that in case these distractive office noises do that. Thank you for that. Well, I want to thank Joy and Keon and Chris for the information provided. And I also want to encourage those of you that are participated or even listening later to provide comment. We welcome your comments, whether they be verbally submitted or in writing, and you can do them in writing to the address that's available at the website through May 11th. And otherwise, we just thank you for participating in today's event. Your feedback is appreciated and welcome, and is considered as the staff makes plans, and it gets evidenced by the repositioning and restructuring of some of the services for the next plan year. And with that, I think we will conclude this public hearing.
Thank you, Larry. Thank you, everybody, for coming. And remember to register for the expo on May 20th on our website. Thanks.
Thank you.
Thank you, everyone.